introduce myself. I'm Jesse Noviello, the Southern Maryland lead organizer with Progressive Maryland, and I'll be the moderator for the panel discussion we're going to be having tonight around drug decriminalization and harm reduction. I want to thank everyone for hopping on tonight and choosing to take part in this important conversation. And just to give everyone a couple of notes on how to ask questions, we have, there's a Q&A you should see down at the bottom of your screen where you can put questions into the panelists. It's also the chat function, which you can use as well. Just make sure on the chat function, make sure you know who you've selected to speak to. You can, by default, I think you send messages just to the panelists. So me and the panelists will see it. You can also send something to all panelists and attendees, or you can send the question to any individual panelists. So before we get started with the panel, I just wanted to take a second to sort of frame the conversation we're having tonight and why it's so important. You know, our country has heavily criminalized drugs and engaged in a massive and decades-long crackdown on both their sale and their use. And this crackdown has been so intense that it has become widely known as the war on drugs. And during this time, over 31 million Americans have been arrested on drug-related charges at some point. And at the same time, we saw over 67,000 Americans die from drug-related overdoses in 2018. And that number has been trending upwards, not downward, for years. And so it's just quite clear that our current approach has resulted in both unjust criminalization, particularly of people of color, while failing to provide the public health infrastructure we need to end the overdose crisis. If the panelists are able to turn on their videos, that would be super helpful. And I'll go through, I'm going to introduce the bios of everyone we have speaking tonight. So first, we have Rajani Goodlevalati. Hoping I'm pronouncing that correctly. She's the Community Organizing Manager with the Baltimore Harm Reduction Coalition. She joined BHRC in January of 2018 and has been bringing with her over a decade of experience working at the intersection of social justice, public health, and the legal system. In March of 2017, she partnered with BHRC and several other harm reduction leaders in Baltimore to create the Bridges Coalition for overdose prevention sites. Rajani is also a facilitator with the Baltimore Racial Justice Action, as well as a writer. We also have joining us on the panel tonight, Aaron Woody, who is the Chief Operations Officer of Voices of Hope, as well as a Regional Harm Reduction Ambassador for the Baltimore Harm Reduction Coalition. He was born and raised in Cecil County and is a passionate advocate for harm reduction around the state of Maryland, drawing from her life experiences. Erin is a master presenter of the Drug User Health Framework by the Maryland Department of Health and uses this as a tool to educate community members, primarily in Cecil and Hartford counties, on the positive impacts of harm reduction. And then finally, last but not least, we have Mia Mason, who is a 20-year veteran and is running as the Democratic nominee for Maryland's 1st District. She's the first LGBTQ veteran to run for Congress and plans to flip the first district to restore equity and equality within our communities. Mia recognizes that the opioid crisis is one of the most serious underlying issues that we need to address with harm reduction strategies, safe use sites, and national legalization of drugs. So I want to take a moment and ask everyone to sort of think a little bit about what you know about harm reduction when it comes to drugs and drug overdose, and what does harm reduction really mean to you? And if folks could drop into the chat what they think of when they think of harm reduction, what they think it means to all of us, that would be great help for us to get started.
Hey Jesse, can you go ahead and start our videos, please? We are blocked by host.
Okay, thanks for letting me know. Okay, you guys should all be co-hosts now, and that should give you control over your own video setup. Yeah, so as we sort of see some of the responses coming in to the chat, I'm also, of course, going to pass it to the panel. So I don't know if anyone wants to jump out to go first on what they see, what harm reduction is, and sort of jump in. Oh, looks like we have lost Erin temporarily. Hopefully she's able to rejoin. I know she's messaging me that her internet was having trouble connecting. The joys of us all being from home.
Yeah, I mean, I'm happy to jump in. Feels like appropriate. So, hi again, everyone. I'm Reggie Goodlove-Valetti. I use she/her pronouns. I'm the community organizing manager with Baltimore Harm Reduction Coalition. And harm reduction means a variety of things, right? And so as I'm looking at the chat, I see radical love from my colleague Trisha, absolutely accurate. Compassion is coming up, restorative justice, these reducing harmful effects of drug use for both the individual and the community, beautiful, like negative social and physical consequences. This is absolutely all true, right? So the way that we, if you don't mind, I'll just kind of share BHRC, how we approach harm reduction, to share this individual. What we tend to do is talk about it from this individual and institutional level, which also often is thought of at individual and community level, right? And so, so the individual level, harm reduction expands choices, right? It's about autonomy. So it increases access and promotes opportunities to assist people in being safer, how they identify as, and how they determine as individuals with autonomy, how they determine what is safer for them, particularly when engaging in culturally stigmatized behaviors such as drug use. So harm reduction very much is focused on drug use, focused on including, and when we say drug use, we are also talking about selling, as well as sex. And so we say sex, and that includes sex, but also specifically sex work, as well as homelessness and housing and environmental justice, all of these pieces, reproductive justice, all of that is it's all an interwoven web. But when we do harm reduction work, it very much is around drug use and sex. So at an institutional level, harm reduction aims to shift organizations or systems and our broader culture. It's very much about culture change to be safer for individuals and communities. So even if you have individuals who are in their own time and their own journeys making behavior changes, we need our entire society that has been indoctrinated with racist, classist, xenophobic understanding of drug use and drug selling. We need everyone to change, right? Because stigma causes isolation, causes fear, causes pain, and that can get folks back into a cycle they might consider harmful as individuals, right? So it's really about culture change as well. So society and the systems within it, and when we say systems, we're talking about the systems we interact with, right? Capitalism is a system, but education system, et cetera, have historically increased harm to people who use drugs or engage in sex work through oppressive policy, which we'll talk about a lot here, as well as stigmatizing culture. But really, it's about meeting people where they're at without leaving them there. It's about radical love, compassionate care, all these beautiful phrases that we're. So yeah, that's kind of a spiel that we use when talking about Baltimore Harm Reduction Coalition. And I just want to say, I know Erin had to pop off because of internet issues, but we work really closely together, and I hope she is a firecracker of a harm reductionist, and I'd love to hear how she might want to add to it, hopefully when she comes back in. But that's what I would say.
Absolutely. Yeah, and I don't know if you would want to chime in here on what you think of with harm reduction, and especially, what the federal government as well could be doing more of to support harm reduction work as well.
Well, honestly, I think that one of the biggest things that we can do on the federal side is change their mindset about this war on drugs. Basically, it's a failed evolution since Reagan and others started it and carried the torch on it day in and day out to bust people's doors down, stop them, frisk them, put them in jail for paraphernalia, can't even carry a syringe around. These are the things that, on the federal level, it's stuck down in the local level because somebody's arrested and then jailed, and then it just becomes another number in a statistic, and we have to wait years and years for them to get out so that we can then fight what was, basically a form of discrimination and decriminalize it. This is why on the federal level we have to be able to support a bill like HR 2569 so that we can actually continue to provide programs to continue harm reduction from the federal level to help our states and local organizations.
Can I also add one thing too,
Sure.
just to get a little history nerd out here, is at BHRC we do workshops and trainings around the war on drugs and racial justice. That is one of my favorite parts of the work, and I'm so thankful that Mia named, the war on drugs, which is designed, often people call it failed, but when you really look at the policies, it was specifically designed to target Black people and poor people. So it is doing exactly what it was designed to do. It was not designed to save lives. It was not designed to end overdose. It was absolutely designed to dismantle systems. And you can see from quotes from the, I believe, executive counsel to Nixon, John Ehrlichman, stated that's what we were doing. We were absolutely here to break up meetings, vilify Black folks, vilify hippies. That is what this was for. And even when you look back to this whole connection between federal and city and state, the very first drug prohibition law in the United States was about 145 years ago exactly in San Francisco, where they outlawed opium dens. And then the idea around opium, that was because of xenophobia based on due to Chinese folks moving in to be laborers, cheap labor. And the fear mongering that occurred around that in San Francisco, and then the movement of Chinese folks and various Asian folks across the country as railroads were being built, caused other jurisdictions and states to join that, we should really ban opium dens too, we're connecting it to Chinese people. And then it became a federal law, right? And so it's this example of how the city connects, like city jurisdictional legislation absolutely influences federal legislation. And I just wanted to put that out there because we don't always think about this stuff like way back in the day and the relationship between these different levels.
It's even more prevalent in today's history. If you just go back to when we used to have a constitutional amendment against like alcohol, and then you know what, we had to repeal that. So why don't we just get rid of the ATF and the DEA for what they're doing, and allow us to have these drugs with open clinics that can help us use the drugs properly and safely, and provide a business to CVS, Walgreens, so they don't go bankrupt.
Absolutely. So I also wanted to ask folks on the panel about, why you support drug decriminalization, and also what does that look like? So Rajani, I don't know if you want to start first with that on sort of what that what that would look like and why it's beneficial.
So I think if anything, I hope people are able to leave this space. Well, of course, considering a vote for Mia and also supporting BHRC and Aaron and Voices of Hope, but also really understanding the difference between legalization and decriminalization. Often they are incorrectly used as synonyms, but the impacts are vastly different. So I think good examples are to think of like cannabis, right? So cannabis in most of the states where they have progressive policies around cannabis is legalization, which means that it has been, it is regulated by the government, and it is regulated, and it becomes, and then depending on various things, it becomes part of private industry, right? So then you can have folks who can benefit and gain profit off of it, right? And in certain cases, the strain gets all, different manufacturing around the strain. It can really shift the entire economy. Not to mention that legalization rarely, if ever, considers reparations for the millions of Black and brown men who have been incarcerated, essentially murdered for selling and buying and possessing, or not even possessing, cannabis. Even to today, the smell of cannabis is used as a reason to stop and frisk young Black boys. So if you think about that, right, and then you think about the Apple Store-esque cannabis shop that is run by mostly white men, there's something going on here, and a lot of that, I think, comes from this concept of legalization. Like, oh yeah, now it's legal, so now we can do it, right? And it sort of, it doesn't include reparations, and it doesn't include, and then it gets too much government control in it, which gets into a whole thing, but it just gets a little iffy, right? Whereas decriminalization kind of opens some doors around, let's just take a step to ensure that folks are safe from police harassment, that they are safe from engagement in the criminal justice system, and actually can continue to maybe create their own, safer economy around it. And so decriminalization it can look like a lot of different things too, but let me give specific examples. Is the cannabis industry tends to be in the legalization world. And then if you think about the types of policies and issues that we're trying to fight for, such as or needle exchange is a really good example. So syringe exchange programs, it is not legal to use heroin, right? It is not legal to put drugs into your system, but we have now made it okay, and in various places legal or decriminalized, to carry paraphernalia, so that you can't be stopped, and for it to be this sort of connecting of dots that police will use to say, oh, you're doing drugs, so now I'm going to arrest you, right? It gets into this really weird gray area. Overdose prevention sites are spaces that we have been advocating for quite a while. I can get into a whole thing about it, but I think the quick thing to say is they've existed for 30 years. They are spaces, and no one has died of an overdose in any of these spaces. Over 150 exist in the world. Millions of injections have occurred in them. No one has died. And I'll say, the piece of it that gets people kind of worked up is that it is the act of using drugs inside of a site. So you go inside of a building usually, or a van, and it is decriminalized. So it is okay to carry, possess a drug that is otherwise illicit or illegal outside of the building or at a certain distance. And it is okay to use the drug under the supervision in there. And so that is often decriminalized in that space. You will not catch charges if you are using in that space. And that has saved lives. And that has felt safer and dignified for folks. And so I hope people are able to kind of follow that journey, but there's various ways legalization and decrim can work. And I don't want to say legalization is terrible. I just say I haven't quite seen it work in a way that's actually rooted in justice for folks and actually helps people feel dignified. But yeah, I'm definitely curious what Mia has to say about it too.
Well, bottom line, drugs always have to deal with one thing. That's money. All right? How can somebody make money with drugs? Either illegally or legally. And the way that the federal government has to be able to see this is that we are, instead of having a war on drugs, giving police all the money to have a war on drugs, we are converting that money to basically provide it to a social system so that we can provide the education, the training centers, and provide, health care that allows us to have a center so that you can actually have harm reduction programs. Plus, the biggest thing that everybody's suffering from right now is jobs. Let's make sure that these centers are staffed so that we can go forward into the future knowing that if you happen to have use of a drug or need to use a drug in order to function daily, you have a place to go to. And of course, the distribution sites can be federally controlled. This is what the federal government can do for the states without giving them millions and billions of dollars to militarize their police.
Ooh, yes, exactly. And something came to my mind and it just fell out. But dang, I forgot. I got really worked up about that. I'll find it. It's okay.
Yeah, I did have a follow-up question for you. Could you give us a little more information about what some of these, overdose prevention sites look like, where they exist, how they've operated? Because I know that's something not a lot of people have thought of how that would work or what it looks like, but it's definitely something we're advocating for. So I'd love to hear more about that.
Yeah, I'm happy to talk about it. So overdose prevention sites are otherwise known as safer injection facilities or safer consumption spaces, supervised injection facilities, all sorts of names. As I previously said, there are over 150 that are legally operating around the world. None yet are legally operating in the United States. Philadelphia is very close. Seattle has been very close. New York, Baltimore has been closed, and actually Maryland, I will say, because and I can bring up what that legislation looks like in a moment. But so yes, 150 that exist around the world. They're usually kind of in three different models. So one model that is the most common, I didn't say where they are. So they are usually predominantly in Europe. There are some in Canada, mainly Vancouver and Toronto, but also other parts of Canada. Mexico has one. Cannot remember what city, but it's on the west coast. Australia in Sydney have a couple, and I believe that's all of them. So they are predominantly in Europe, and and the first one I believe was in Switzerland 30 years ago. And so they tend to be definitely coming from a public health perspective. I remember the thing I was going to say. So the funding model, speaking of money, the funding model looks very different in different places. Of course, it all depends on government, et cetera, right? So in Vancouver, as an example, it is partially funded by a nonprofit organization that runs it and staffs. All the staff are employees of that nonprofit. It's also partially funded by the province. So it's like Maryland Health Department funding, right? And it is mixed. And over the course of the 20 years that specific place I'm thinking of, Insight in Vancouver, has been operating, depending on the liberal to conservative politics, the funding has shifted. So at a point they had very conservative politics, and the nonprofit was pretty much funding the entire thing. So I bring that up because that is a question that often comes up in Maryland and with legislators, is who would fund it. That is one benefit of decrim versus legalization, or at least saying when we are talking about in Maryland, we say we want legal authorization to operate them. We are not saying we want the government to operate it. We're not saying we want Hopkins to operate it. We're saying we just want legal authorization for it to exist. And that actually takes the fiscal bill down to nothing because we're not asking for money. I just wanted to say that because the funding is always a big piece. So the way it looks, you can have a standalone, you can have intermixed with an existing nonprofit, or you can have a mobile. So the standalone is like a building. Just imagine any building. I've seen a bunch of these. I've visited these operating around different places in North America, and you can walk right by it, right? And it's just part of a storefront almost. Standalone building, you go in, it's usually separated in 3 different places. So there's a welcome area so that people aren't necessarily using like in front of the window while pedestrians are walking by. Like, I just want to put that out there because people get really interesting ideas.
Nor in
welcome
the stairways.
Yeah. Welcome area, very, very compassionate, because the thing is, not only, like I said before, has no one ever died of an overdose or died at all in any of these spaces. Another very important piece to OPS is that it is the welcoming, compassionate nature, right? It is people feeling dignity. It is building relationships so that the person who's coming in every day or so is feeling welcomed, right? Not feeling like a patient or a distanced. So welcome area, then there's the supervised use area, there's booths, supplies are being provided, fentanyl testing strips, hygienic supplies, etc. Then there's a third area that's usually called a chill zone, or just sort of like a get yourself good to get back out, go to work, or whatever is in the person's day. And in that third area is where a lot of magic happens, where people are building connections or are connect. Usually those are peer workers are working there and saying like, hey, you've been coming here a lot. How you doing? Somebody says, I'm thinking about detox. The person's like, oh, here's a pamphlet about it. Or I could tell you about my experience in certain detox places. And then people can also say, don't talk to me. I just want my coffee. And you respect that, right? And you use that opportunity to build relationships. So that's usually how it looks. And that can look like a lot of different things in each of the types of spaces. But I, again, can talk about this forever. I'll just reiterate, Bridges Coalition for Overdose Prevention Sites is a coalition that's existed since March 2017. It's based out of Baltimore. It's a statewide organization in Maryland. About 24 organizations are part of it. If you are part of an organization that you think would want to be a member of Bridges, advocating for OPS to be legally authorized in Maryland, to contact us. I think Trisha's in the chat, my coworker, if you don't mind Trisha, putting some contact about it. We have videos about it, all sorts of stuff. We have monthly meetings. So that's all I'll say. 'Cause really, that's my soapbox.
Excellent, excellent. So we've got another question from the chat about someone's asking about if drugs are decriminalized but not legalized, like where do those drugs come from? Like how do the sales of the drugs look like? I also have someone else asking about
I can answer that one.
Safety of drugs in terms of like how could they be quality controlled under like a legalization? Like how do you know what's in the drug? You guys want to weigh in on one or both of those? That'd be great.
Sure. So to start out with, the FDA is going to have to be able to oversee these drugs. They already make their own marijuana. They allowed others to make their own hybrids of marijuana. And if we allow our pharmaceutical companies to make any type of drug tested on us, including the vaccine that's supposed to be made for us, and have it by 2021, here's the bottom line of what the government always needs. I'm not a lawyer, nor, am I going to go to school to become a lawyer. It takes a lot of time and you have to be super smart. But here's the thing. When you go into CVS, you need 2 things to get a drug. ID card, credit card. They scan the back of your ID card and it goes into their system. You use your credit card to make a payment. There's the money. There's your tracking system. And if you need a prescription, you know where to go. We'll provide the healthcare system to help you with that. And then, of course, with the treatment facilities, you know what? You probably need a business or a place to do that. Well, there's plenty of hotels that are out of business and for sale. So an organization that's nonprofit or profitable, the government can provide those businesses or nonprofits a grant so that they can cleanly operate and safely do it with their staff 24/7, 365 days a year, so that they can help reduce all the opioid crisis that is happening around the entire country. And this also provides additional options so that if you are thinking about it, you have a place to get educated on it. So if you do get addicted or want to get weaned off of it, you have a place to go. And like she talked about, you have a support network there 24/7 to help you out.
That's great. And so to add, I think what we need to do is also kind of break our brains open about what's happening now, right? So let's imagine a world in which drugs are decriminalized. That also means that people who are in the economy and who are selling are not as policed, as violently policed, right? Because they are not seen as a criminal element, which requires a deep, deep amount of culture change and working on our racism. So that's a whole large piece, right? It's not an easy overnight thing, but it will get us towards that a bit more. And it'll actually kind of, I don't know, colleagues of mine who are folks who are peer outreach workers, I call upon them to help me. A lot of older Black men who've been in the game and out of the game who've taught me a lot about this. Is like, it'll just create a lot more flexibility and pause out on the street, right? So even if there's still street economy, we have to kind of rethink how we think that's bad, right? Because we think it's bad because of violence. Violence often is occurring more at the hands of police than anybody else, right? And I don't want to say that it's just that, but it's the complicated thing I just said, but it is due to police interaction, surveillance, fear tactics that are causing a lot of violence. So if that's removed, is more so what I mean to say, then let's think about what that community would look like, right? And so then when we're talking about the space and time that people who are using drugs will have, there are fentanyl drug testing strips, there are cocaine drug testing strips, there are testing strips that are legally allowed for folks to carry everywhere. And we at BHRC give them out. Erin, who was on here, who unfortunately has bad internet or unstable internet, she gives them out too. So people are able to test their drugs, and we give people space to do that, right? We kind of help them. But the problem is that is all criminalized, right? The act of having a drug that you can then test, right? So if all of that was decriminalized, people have time to test their drugs, test the quality, and say, okay, is this something I am ready to put in my body? And if people say, yes, I want to put fentanyl in my body, which we need to really accept, that's what people are saying, then I can say, okay, can I just be here to supervise you with my naloxone in the case something goes awry? And we can do that without fear of police and criminality, right? We can do that. And I think we can get access to cleaner syringes, and we can get access to these things with pause, with intention, in a way that people are just kind of going fast, just doing a lot, and it's not as intentional, it's not as safe. So I think that's the kind of culture shift we have to start thinking about, is how will this impact?
And I agree with you. One of the biggest things that we have to be able to push is that legalization and that decriminalization. Because, a long time ago, we could refine things, make things a product. And I'm talking about sugar, right? People don't see it as a drug, but we use it almost in everything. Imagine if you could go to a place where you could actually see the process of an opioid being made, fentanyl being made, and watch it from beginning to end, all the way to the packaging, so that it could show up in your treatment center and that you knew that it was quality controlled from start to finish. That's the future of America that we need to have in the next 50 years or sooner.
Yeah, so one thing I'm getting a lot of questions on in the chat from folks is sort of what is the sort of end goal of harm reduction? And, is it to get people to abstinence? Is it to connect them with treatment? And how does it relate to some of those things that I think people are thinking of traditionally, like rehabilitation and stuff like that? How's it different? How's it same? And what is the sort of goal?
Yeah, the goal is health, safety, dignity, and justice for all people. That is the goal. Health, dignity, safety, and justice for all people. So if that dignity looks like abstinence, all right. But also, drugs give us pleasure. And I feel like we have to be real honest about that. And if folks have not read Adrienne Maree Brown's book, Pleasure Activism, please do it, because that book is brilliant and it is very honest. It's like, people use drugs, people have always used drugs. So I think it's just like, can we just like calm down? And remember that people use drugs. Like, I think that's a really big piece. And I'm saying calm down, and I'm being flippant because it's a nighttime and I'm being flippant. But I know that there's danger around it. Please believe me, I know that. I'm not trying to be flippant about that piece, but I do think we need to acknowledge that drugs will always exist and humans will always consume them. So what does it look to do that in a way where it is centering the joy or pleasure that we might get from it, and not the pain and the criminality and the chaoticness that can occur, right? And the chaos tends to occur when we lose our job, and we lose our house, and we lose our partner. And we are using drugs as a way to avoid our trauma, and not really because our culture and our society doesn't uphold mental health care as much as we should, and trauma-informed care and transformative care as much as we should, right? And so those are the things I think we really need to talk about, is not the drug, right? And so I just believe strongly, and working with all of the folks I do in the harm reduction over a decade, abstinence works for some people and it doesn't work for all. Treatment works for some people and doesn't work for all. One of the most brilliant people I've ever known, who I worked closely with, has been using methadone maintenance medication, I think 20 years. And he's doing just fine. I mean, he's got stuff going on, just like any other 55-year-old man, right? But he is doing just fine. And so it's like, and he's not really planning on ending methadone in his life anytime soon. And part of it is because he goes to a clinic, IBR Reach on Maryland Avenue, that is so caring and so loving and so compassionate, and provides a variety of health services. That is very rare for methadone clinics, right? And so I think it's just really understanding, what does it look like to be compassionate? I completely forgot the question. I just got really dreamy, but I think those are the things we need to think about. And so but I want to say again, if folks are about abstinence and in your life, and that's what works for you, that's a beautiful thing. And I wish everyone the best for that. But when you push that on other folks, just like religion or politics or anything else, there's going to be a backlash. It doesn't always work.
I understand there's going to be a lot of backlash, especially because we want to be able to provide all three options. And that will definitely take care of everybody's need, because everybody has a different mindset about what a drug is. Some people it's sugar, some people it's alcohol, some people it's actually the opioid, or it's actually, codeine or other things that actually will help them, like you talked about, fentanyl. These are powerful drugs, so if you want to abstain, if you want the treatment for it, or you need to be able to function because this is the drug that you were born and raised with, it's a medical treatment that needs to be provided. It shouldn't be denied. This is why when I talk about Medicare for all, I want to make sure that we're taking care of everybody, no exclusions. And this is, part of the future of where we have to take a look at each other and say, look, if I ended up in that situation, can I get through it and help somebody else and have the heart and the mind to do it? Provide that helping hand to help another person.
Yeah, absolutely. And one thing I am also getting asked is, what is sort of the role of broader mental health within harm reduction work, because we obviously know, like, there's definitely a connection sometimes between general mental health issues and drug use and abuse.
Yeah, so with mental health professionals, there's always a different avenue, a different case, a different patient. Everybody has to be a case-by-case basis. Having 4 separate subject matter experts for each type of drugs could be a possibility. But honestly, even if they start out as an intern, we want to be able to have people that have a passion to do this, not there just to be there 9 to 5, push numbers through, push people through, and then, have an end result at the end of the year because their quarterly cycle is up. That's not going to be harm reduction. That's going to be like Trump's goal of, like, we're going to, get rid of everybody by eliminating the program. That's not going to work. So we need to be able to have that broad reach of mental health professionals to, be sensible to each person. That's going to be part of the resume. That's why we have, the requirements when they get hired as a employee or employer to help these programs for the people in our communities.
Would you be able to repeat the question, please?
Yeah, I was asking about sort of the intersection of mental health with harm reduction work around drugs as well.
Yeah. They're right. So they're intertwined, right? And so I don't even see them as separate or different. And I get. I'm sort of having a moment. I'm like, oh, it's a reminder that that's not always seen so distinctly as connected. So when we think of mental health support and trauma-informed care, those sorts of language, that kind of buzz phrases that tend to come up, harm reduction is very much rooted in that. And I do believe that you can't necessarily, the best therapists I've ever had, even before I did harm reduction work, were people who were coming from a harm reduction perspective, who were talking to me with a non-judgmental approach, who were meeting me where I was at, not leaving me there, coming with radical love, all of these pillars that we keep talking about, not judging me for any drug or alcohol use that I have had in my life, my sexual habits, nothing, right? No judgment around that. And that is harm reduction and really good mental health care. And so we have to think of those things, as well as harm reduction really strongly believing that if a drug is working for you, then great, like let's get access to it in a way that feels healthy and safe, right? And so, that goes with a lot of medications used around mental health care. And so I am glad, that it took entirely too long for government systems. I think it was within the past 6 years, it was 6 years ago, 5 years ago, that Maryland State had a separate substance use department. Maryland State Health Department had the health department, and then the substance use administration, and then the mental health administration. And they were distinctly different in different buildings. And then the mental health and substance use departments finally came together and became now the Behavioral Health Administration, BHA. So BHA has been working closely, and ever since BHA came to be with this blending in Maryland, we are seeing significantly more funding and support for overdose prevention that is rooted in harm reduction, that is rooted in recognizing mental health care. So I think those sorts of things are really important.
Yeah. I remember in my military past, I used to have to take soldiers to ASAP and also to ABH, which were two different doctors. And I'm glad that it's all one program, even in the military, to take care of those who need the help so that they can continue to serve or be separated.
Absolutely, absolutely. Another question I'm getting, and it's probably more for Mia, is around what are sort of like the political obstacles, and like who are, or what is the thing like keeping our current system going of continuing this war on drugs, and what are ways we can sort of overcome that?
Let me get a little bit closer. It is the private prisons that are for profit. With those still in place, we cannot end this war on drugs. The GO, the ICE, the DEA, the ATF, you get arrested by them on a federal charge, you go to a private prison and they make money off of you. That needs to stop.
Yeah, I mean, I'm just going to say I'm a prison abolitionist. I think the entire system needs to completely go away. So I'm not going to get into all that. But
that's my question.
Yeah, that's where I stand. And so definitely with the privatization of the prison system, absolutely. But also publicly funded prisons are also terrible and evil, right? So I feel like we need to, when we abolish private prisons, our work doesn't end there. So I just want to remind us all of that one.
It's a stepping stone.
It's a stepping stone for sure. I'm with you. Yeah.
Absolutely. Absolutely. Yeah. So I just want to let everyone know we are going to be closing up in about 5-10 minutes here. But yeah, if folks have any last questions, feel free and drop those in the chat. One question I am seeing is about the role of pharmaceutical companies in this. So if you guys want to jump into that in terms of,
I think this is probably more of a question for me on the federal level.
Yeah, you can definitely.
Mainly because, the government's going to be providing grants to make sure that these programs happen. And if we do provide any type of future legalization or decriminalization, we understand that people will have to apply through the states in order to produce those drugs. So that's where, the question of big pharma comes in, and of course the small business owners who will be looking to apply for those federal licenses to then set up shop if blessed off by their local governor in a state of their choosing. And hopefully we can bring some of that business here in Maryland and provide some of that federal grant money in the future if we can get harm reduction passed. It's still sitting in the House as introduced, but with the committees, hopefully we can bring it forward into reality with a change in power and in the Senate.
I just want to add one thing, and I think I see a question in the Q&A about Black folks, African American folks being disproportionately impacted by criminal justice system and overdose and drug use, right? And so I appreciate that question. I think it was William Reed named it, and I appreciate you for naming that because, yes, it is true. Black folks are significantly disproportionately impacted by the racist anti-Black war on drugs. And I think that is something that always needs to be brought into account when having conversations about drug policy, is ensuring that we are having Black voices in the space. So I see you, William Reed, and I appreciate you for putting that in there. And I bring that up also now because I would love, and this is me going on a TED Talk for probably 6 hours, so I won't do it, but I really, really want to have a conversation about how big pharma and that concept very much is often, and yes, pharmaceutical companies, awfulness. And it is a detour and a distraction from recognizing that the racist anti-Black war on drugs still targets poor Black communities and brown communities and has nothing to do with what legal pharmaceutical companies are doing. It has something to do with it, but it predates all of that because it is about the underground economy of pharmaceuticals, right? This underground, non-legal pharmaceutical industry that exists because most Black and brown folks haven't even been able to get access to legal medications that we need for pain management, etc. So when we're talking about pharmaceutical companies, I really need us to use a racial justice analysis on it sometimes. And I'm still building mine, but I needed to say that because that's just really important to name. And I would love to have that conversation with folks if you want to in other spaces.
Yeah, for sure. So one question I'm also getting is, what are steps, folks in the public can take to support harm reduction work or decriminalization efforts at both like a local and national level?
Yeah, I can just say local real quick because I don't know national really, and then you could take it away at the national, starting from the bottom up. So Baltimore folks, so many things always. One thing I'm just going to put out there because I'm going to be at it is Saturday. The Coalition Against Hopkins Police is doing a rally and march in East Baltimore at around 11:30 a.m. On Saturday the 15th. And I think all of these pieces are connected. And so I'm there, holler at me. And I think that's just something to know is like this movement to demilitarize, depolice, defund police in Baltimore is still going. Still follow that, right? Like Baltimore Block, these groups, the youth, those groups are still pushing these pieces that once there weren't any marches anymore or less marches, we're suddenly moving on. Like that's not appropriate. So we still need to be present for Black lives. So let's work on that more. And then as far as city council and work, I will say in September, there will be a hearing around the overdose prevention site issue. So we have been, and that's the connection to the state level, is we have been working, it'll be in 2021 will be the 6th year, that's 6 years that advocates have been putting up a bill for Maryland state to legally authorize overdose prevention sites in the state of Maryland. And so it has been at a state level and to ensure that it is more widespread across the state, because overdose rates have risen across the state, but also to ensure that there would be these spaces in Baltimore City that are community and peer run is our hope at the community level. And so while it has been a state level bill, that obviously we don't have bill numbers or anything yet because session's not for a minute, but it'll show up quickly. So if you are interested in the overdose prevention site issue, again, my colleague Trisha has put in the chat ways to connect with the Bridges Coalition. We're definitely looking for more advocates to be part of that. That is a way to connect and join that movement. And the city council is considering just mostly really an informational hearing at this point to learn more about it, because we do know that whenever we do advocate at the state level, where we have received 0 oppositional testimony, but we have increased the number of supportive testimony and champions on bills each year, and it still doesn't go forward because of culture stuff. So because of fear and all the things. So if you're a Baltimore City resident, there's a city council info hearing in September that you should definitely try to join or connect around. If you are not a Baltimore City resident and you support OPS, please connect with us. We need to build more power across the state on these issues. And of course, also I will name paraphernalia and Good Samaritan laws are 2 other really big issues. Decriminalizing sex work is another big issue that we support with sex worker-led organizations. But paraphernalia decriminalization is essentially to ensure that people can carry the supplies without harassment. And so that is another bill that we will be bringing in session. And Good Samaritan, look it up. It's a whole thing. But those are sort of the big ones. I can think of. Yeah, please.
Okay.
Absolutely.
Certainly. So on the national level, we're going to be looking into September once everybody comes back in the legislative cycle. Get into the committees and try to find out where they are in DC. Get into that hearing room so that you can actually be there and be part of the process. I dropped my events down there so that you can join me this Friday at a Black Lives Matter event. I'm always across the, entire district, which goes from Tawnytown to Elkton down to Ocean City. So it's a vastly gerrymandered district. So you might see me somewhere and you just got to follow me or watch me here. I'm here with you right now. Share this event that you're watching right now on your Facebook page or your Twitter feed or your Instagram, so that we can get the word about what us panelists are talking about tonight. That's how we're going to make this change, especially when it comes up to the state level here in September as well, as you heard. So let's make this movement go forward. You can come to my website, miadmason.us, follow me on Twitter at Mia4MD, and ask me questions. You can absolutely give me a call. It's 410-94-MASON. Call or text. I'm the candidate that answers that phone. So if we want to continue this conversation about harm reduction, I'm going to turn it over to Jesse so that you can learn more.
Absolutely. Yeah, so I think we are going to wrap up here. And I definitely, Progressive Maryland as an organization is going to be continuing to work on these issues as well around harm reduction and really trying to educate the community, and we are also trying to recruit new members as well, and I believe my colleague Zach will be dropping a link on how to sign up as a member with Progressive Maryland. But I want to thank our panelists for jumping on for this discussion. I think it was a really valuable discussion to have. These are issues a lot of folks have not thought about before. So thank you so much, Mia Mason and Rajani, for jumping on. As well, shout out to Aaron Woody, who was not able to join us for most
We
of
miss
the
you.
conversation, but did want to thank her for helping prepare and agreeing to come on. Yeah, we'll also, in addition to in the chat, we'll be sending out a follow-up email to everyone with ways to connect with the speakers and some of their upcoming events, as well as some stuff about Progressive Maryland. And yeah, with that, do the speakers have any, do either of you have any last words you want to say before we close out?
Let's end this discrimination, this war on drugs, and let's make harm reduction possible in the next 5 to 10 years before this 50-year cycle. Thank you. Have a great night, everybody. Rajani?
Yeah, well, that was really good. I should have gone before you. I'm just going to plug a bunch of stuff. So Baltimore Harm Reduction Coalition, we have a few events coming up in August I just want to put out there. So August 31st, is that a real thing? August 31st is International Overdose Awareness Day. And every year, Baltimore Harm Reduction Coalition organizes a celebration of life the day before, or the kind of within the couple days before. And so we call it a celebration of life, say, you know, we deserve to take space to celebrate life. It's usually a really dope party in person, obviously not going to be that, but it'll be a virtual hangout thing all day Saturday, August 29th. Lots of different opportunities to engage with us. And so please check out the BHRC Facebook and Instagram, and there'll be information about it. So Saturday, August 29th, Celebration of Life. You know, please join us to celebrate and acknowledge all of those who we've lost due to overdose. And also we do wellness events to kind of make sure we're all doing all right. So I think August 25th is about water. Again, really just check our Facebook page. We have that. And next Thursday, the 20th, we are doing, we have a monthly educational event, and it is around harm reduction in places of worship. And so it is called Collective Care, Keeping the Faith. So it's at 2 p.m. next Thursday, the 20th. Lots of things to remember. Check out our Facebook for that info. Please register. It's all free. So that's all. And yes, harm reduction, dignity, justice, beauty. That's what we need. Pleasure. Go enjoy your evening. Thanks, folks.
Enjoy your evening.
All right. Thanks again, everyone. Have a great night.
Bye. I'm Ian Mason. I'm running for Congress. Our voters are at the helm in 2020 because our education has failed us. Our infrastructure has failed us. With your driving force, we can fix that, especially in our healthcare, because your vote actually matters and you have the choice in 2020. I'm Ian Mason, and I approve this message.